Hi, everyone. Thank you again for attending our first Eco Impact podcast. Here we have with us Dr. Lin and Mr. Pintea. If you guys would like to give a little introduction about yourselves, that would be awesome.
My name is Carole Lin. I'm a pediatric anesthesiologist at the Lucille Packard Children's Hospital and Stanford Department of Anesthesia. I am a director of sustainability for our pediatric division, and I do a lot of sustainability work. And Sebastian and myself, we both are passionate environmental warriors.
Awesome. Hi, everyone. My name is Sebastian Pintea, and I'm a fourth year at Stanford. I'm currently studying environmental systems engineering with a minor in Spanish on the pre-med track. And Dr. Lin kind of said it perfectly. As a sustainability warriors, it's been a pivotal part of my experience at Stanford, whether that revolves around my research related to the impacts of climate change on people's neurological health or pain, and then also within other extracurriculars at Stanford, like Stanford Climate and Health. And so all these kind of transform a lot of the type of work that I do, especially with Dr. Lin with like Project A-Wish. So yeah.
I'm going to present some visual slides because climate and health really benefits from some visuals instead of just conversations about climate and health. So the scientific consensus is that climate change is a real thing, despite what a lot of politicians will say and what a lot of corporations will say. Doctors and scientists, you feel it. People know the truth that the temperatures are warming, and that is because of human activity. And I wanted to give you some important history that's taking place right now, is that there is a meeting of the UN that discusses specifically climate change and how they declare their goals for the next year. And this is called the Conference of the Parties. So in COP28, this was one of the most important meetings in which they put health at the center of their discussions. And they committed to actually discussing about health systems globally, how to shore health systems up to respond to climate change, and how to put health of the humans in their countries as the most important part of how they deal and look at the climate change through the lens of health. Another thing that was very important that happened just recently was that the International Court of Justice, or the ICJ, in 2024 recognized that climate change, number one, is an existential threat. And number two, they also determined that countries and states have a legal obligation to protect the environment for current and future generations. And this not only gives backing from the UN and the COP28, this also gives an international backing to the legal rights of humans to demand to have a clean climate, and it ties it into the right to have human health. So the climate has been getting warmer and warmer. The last 10 years have been the highest levels of heat that have been recorded globally. There is this record temperature of 1.5 degrees Celsius, in which we try not to hit, because after that point, we actually have no idea what happens. But we are getting very, very close to that. 2024, we hit the global temperature of 1.45 degrees Celsius. And there are a lot of studies that show that the health risks from these heat waves and climate change contribute to a lot of additional deaths per year. There are predictions to say that in the past, they're not predictions, they're predictions in the future, but in the past, there's also numbers and data that show that between 2020, 2030 and 2050, there is about 250,000 people additionally that passed away due to climate change, due to the increased disease burdens and stresses on their systems. And you guys, if you're located in Hong Kong, have experienced this directly. The Hong Kong has experienced the highest levels of heat that they've had in the last 30 years. And in fact, 2024 broke 35 heat records. And the sea level is projected to rise by 1 meter by the end of 2100, and is already rising 3 millimeters every year, which doesn't seem like much, but cumulative, it will lead to widespread flooding and infrastructure damage. I've never heard of black rainstorms, but apparently there are rainstorms that are so extremes that they are the highest level of about like 70 millimeters or 7 centimeters every hour. It's pretty impressive for flooding, but you guys are experiencing that. This is a infographic from the WHO, Climate Change and Health. And it's just a big overview of how climate change affects health in all these different categories. And I was just looking through them. I mean, they're from injury and mortality, from extreme weather events, from heat, from respiratory illness. But actually, they don't even have some things in there like microplastics, direct or indirect effects on our bodies, because things like that are new studies currently happening. Again, heat is the leading cause of heat weather-related deaths globally, and is in 2022 in Europe, they had over 60,000 people that passed away from heat alone. In the US, we had an amount. It's not as much as Europe because we probably have a lot more air conditioning, but globally, definitely there were at least 70,000 more people that died from the heat alone. The Lancet is a prestigious journal, and they were able to put a summary of all the ways that the hot weather affects our human body. Our human body is not meant to be cooked. And these organs that get essentially cooked by heat they fail. And so people who have heat-related heat stress, they go into multi-organ failure. And the organs that are very sensitive to heat are the heart, kidneys, and the lungs. And even after you get heated up and get heat stroke and you think you recover from it, you actually have the high risk for mortality and morbidity from a lot of chronic illnesses due to the heat for many years afterwards. And there are also new studies that show that once you've been exposed to chronic high heat or extreme peaks of heat, that it also affects your aging. Here's a summary of all the news-related events about how high heat can cause not only death, but it can also cause a lot of weather-related injuries, because high heat causes more moisture and more increased storm events. And climate change has a very clear effect on cardiovascular health. So in 2024, an article by JAMA Cardiology, which was a review by Kaizen College, they looked at 500 studies, and they showed that the things that we expect from climate change, the extreme heat, the air pollution, the wildfire smoke and smog, they all cause stress and endothelial damage to the heart and the heart vessels. And this causes the body to have heart attacks and strokes. There's also a article that was pretty groundbreaking in the New England Journal of Medicine in 2024. And this shows that microplastics were found in over half of the patients coming for carotid endarterectomy. That means there's a blockage of plaque inside these big vessels in your neck, and that puts you at risk for strokes. They identified the types of plastics that were in these carotid plaques, and they followed these patients after their carotid endarterectomies, and they found that those with more plastic positive plaques actually had a greater risk of heart attack, stroke, or death in the following months. And these microplastics correlated with inflammation. So they suspect that it's not positive, they need bigger studies, but they suspect that these plastics may actually be destabilizing these plaques and causing strokes. There is a comprehensive review in 2023, which was published in the Annals of Thoracic Society. And they looked at the effect on respiratory health with wildfire smoke, with ozone, with prolonged allergens. And they found that there were a lot more hospitalizations, a lot more severe respiratory illnesses around these events, and a lot more health consequences as well. The populations, of course, that were affected most happened to be young children, those which were premature because their lungs were not very well developed, and also older people with chronic lung disease, and also disproportionately lower income or vulnerable populations because they don't have ways to avoid or get out of these situations of high air pollution. The high heat is also causing a lot of kidney disease, and it's actually a global health crisis. A review in 2024, Nature Reviews Nephrology, showed that there is a new type of kidney disease called CKDU, chronic kidney disease of unknown origin, but they kind of know the origin. It's chronic exposure to high heat. And this is causing a lot of farm workers that are the most vulnerable in Central America, South Asia, and Africa to develop really chronic and acute kidney disease, which is an unrecognized epidemic. And this is not only in farm workers, the pediatric population, I practice pediatric anesthesia, we see a lot more kidney disease in kids coming to us because of dehydration and heat stroke. And there are also diseases that are being spread by climate change. And that's because the insects and the vectors that spread these diseases are changing their range and where they live. And that means people are getting exposed to them in areas that they never have been exposed to. So even physicians, when patients come with these different patterns of diseases, we sometimes don't even know which diseases to look at because they're being introduced new to our areas. This is a very quick infographic showing some of the horrific tropical diseases that are expanding into areas that populations may have never been exposed to. And this is the gross out slide. So the central picture is a picture of what we call a hemorrhagic fever, such as dengue. On the upper right picture, there's a picture of microcephalic infant. And that can happen when a pregnant woman is infected by a Zika virus. It affects the neurodevelopment of the fetus. On the lower right-hand corner is something I'm particularly afraid of because I'm afraid of rats. And they have now this strange tropical parasite called lungworm disease, and so forth. And I wanted to also bring you guys the latest study that just came out that's also freaking me out. Microplastics in the human brain. This is a landmark study in 2025 in Nature Medicine. And the fact that's freaking me out is that they say from their studies and cadaver studies ranging from 2016 to 2024, that not only has there been an increase in the amount of plastics in our brains, but an average estimate adult brain would at this point contain about a bioburden of 7 to 10 grams of plastic, which that's about the equivalent of a plastic spoon. And there is a wide body of literature that is showing that microplastics are everywhere in your brain, your liver, your kidneys, your blood, in our placentas, in our growing fetuses. We eat them, we ingest them, we breathe them in. They're in every part of our lives almost, including healthcare. And we don't even know what they're really doing because the study of microplastics and nanoplastics is just starting.
Yes, because that's a great question because honestly, when we talk about pollution, people often think about the lungs, asthma, or even the prevalence of cancer. And that's often and therefore what's often overlooked is how toxins affect the brain. I'll never forget there was this landmark study that came out, I think it was published by JAMA, and it was like the first of its kind to find a really strong relationship between the impacts of air pollution as well as it was neurological disorders. And one of the main findings is that they found that fine particles like particulate matter 2.5, for example, and volatile organic compounds can actually cross the blood-brain barrier, and this can lead to neuroinflammation. And then this causes an array of other effects such as cognitive decline, memory issues, changes in mood regulation. And one thing I found interesting is when future studies came out, they found a similar link with heavy amounts of air pollution associated with Alzheimer's prevalence, Parkinson's. The list unfortunately goes on. And this also can be seen with children because they're particularly vulnerable since, their brains are still developing. And so communities of color and those that are from low income groups are often disproportionately exposed to this because a lot of waste is often disposed of next to these neighborhoods because they do not care about them. And so as a result, a lot of this will seep into the soil. And the next thing you know, there's high amounts of lead that we find in the grass in certain neighborhoods of like Los Angeles. And that's something that was found recently because of this amount of waste. And so that's why pollutants, they don't just shape our physical health, they literally change how we think, feel, and cope with stress. And so that's why it's important that we specifically look at more of like the neurological pathways of how air pollution really interacts with our brain. But this is really like a first big step into understanding how air pollution impacts our ability to, think properly and being able to cope with daily stressors. Yes. So with climate anxiety, and this was something I talked about when I was, I think, I don't want to say arguing, but I was writing this argumentative paper in one of my Stanford power courses about that climate anxiety or eco anxiety should be a formal diagnosis in the DSM-5, and saying how it is something that greatly differs and is a branch of generalized anxiety disorder. And what it really comes down to is that people have these extreme anxious feelings about the world ending due to the impacts of climate change. And because we often define climate anxiety as about worrying about the future, but also when we're looking at marginalized communities, this is something that they have to worry about in the present. And many frontline groups already live with these effects, such as like extreme heat, poor air quality, flooding, housing insecurity. And for a lot of families, they feel hopeless because it's like all this is moving around them and they cannot do anything. And this creates a cycle of environmental stress and social inequity, which just builds on top of each other over time. And so that's why with like, for example, this paper that I'm writing that's currently under peer review, we're looking at the journey of undocumented children that are coming from South America and Central America and Mexico to the United States and how climate change is impacting each and every step of their journey. And with extreme weather events like El Nino and La Nina, it's caused a lot of families to be displaced from where they live. And I think a lot of people overlook that type of stress that comes with, having to leave your home for all of your life because of these extreme weather events that have only gotten worse over the years. And so that's why addressing climate anxiety, we can start with therapy and mindfulness, but we also have to think about justice, empowerment, and making sure that people are feeling heard and a part of the solution as well. Yes. So I think the biggest thing I found with my experience as a student is community-based mental health support groups and finding peers that share similar interests as me. And the reason why I say this is because recently, Stanford Climate and Health, we were able to make these heat disaster kits that we were able to give to low-income communities in Redwood City that were suffering from effects of extreme heat and also the amount of waste that's often disposed near these neighborhoods that increases the amount of pollution. And imagine in the summer when it's very hot and all that rises to the surface and it just causes an amalgamation of bad impacts. And so we were able to offer these resources and these like and showing that there's just places where you can get like free air conditioners, so that way you can, you know, not feel as anxious about having to manage or having to move to different parts of your house during the summer just because of how hot it is. And so that's why agency really matters here, because, you know, involving communities in designing these climate solutions really helps reduce anxiety and building resilience. I think the biggest, if there were a takeaway message, I would say here is really the point on resilience, in that we have to start adapting and addressing those changes now. And so that's why it's also important when we, you know, uplift marginalized communities with storytelling and advocacy, for them to share their experiences and reframe that anxiety into action. Because I think a lot of people don't care because they don't see it in their own lives. And so that's why it's important that these are the steps that we take, so that way, you know, we could help remedy these types of effects. And also with like organizations such as A-Wish that Dr. Lin and I helped found together, is kind of based on the idea of, you know, making something as simple as an operating room more sustainable. And those impacts have lasting effects with like the rest of the hospital and nationally and then internationally. And so that's just the kind of ways that I would say of ways that we could help mitigate a lot of the stressors with climate anxiety.
I would like to double that, because the way I deal with eco anxiety is to definitely connect and take action. And so when you're talking about the separate groups, like for example, Sebastian's Stanford Climate and Health, it would be good for the organizations to actually connect with not only local community government and institutions, like for example, the connection between Stanford Climate and Health and the Lucille Packard Children's Hospital. We're making those tight community connections. And we work with local nonprofits, such as research, to also address global inequity. But when it comes to dealing with eco anxiety, people have to connect. Groups have to connect. And that leads to what we call a cycle of community and government, in which the government can help the communities live, be more healthy, and the communities can actually give feedback and help governments and guide governments in how their responses should be to help those communities, what their needs are in response to climate change. So some communities may need heat relief centers, and other communities may need more water filtration addressing for their pollutants in the water or contamination. Oh, definitely. the best way to deal with climate anxiety is to find other people that are anxious like you, and then to get together and do something about it, just like what you're doing. So I wanted to share a little bit more about a program that Sebastian and I were using to address our eco-anxiety, is that we put our eco-anxiety into action. We founded this program called A-Wish, which is addressing world inequity via sustainable healthcare. And the purpose of our A-Wish program is to decrease medical waste and also address global inequity. We recover unopened and unused medical supplies, and we distribute them to our nonprofit partners to help address global health inequity. And it's not a novel concept. It's actually been based on programs that exist around the world. More locally, we reached out to Remedy at Yale and Share at Johns Hopkins. And this started from a seed grant that we applied for, and it got support from the hospital systems through our quality improvement programs. And as you can see, that we have staff volunteers that help collect materials. And then we have community and student volunteers that come and reprocess the medical waste and plastics. We started with Blue Up Recycling because it was a very clean and easy process to address. And it's yielded a lot of results. So from our blue reprocessing, our volunteers have been able to divert from landfill the equivalent of a small elephant, about 500 to 600 pounds every 6 months. So that's a lot of plastic we've been able to divert. And then our program, AWISH, has evolved to expand into the pediatric intensive care unit. The pediatric nurses actually did a pilot study and an audit of their waste. So it's pretty standard practice that in the United States, at least, when a patient leaves their room or intensive care unit, whatever medical equipment was in the room, they actually are not able to reuse it to another patient because it's considered contaminated. So they actually just have to throw it all away. But with working with our infectious disease process, we were able to say and get approval for the nurses in the units to separate the medical equipment to either waterproof equipment or non-waterproof equipment. And the reason why we say waterproof is because the volunteers are able to take any medical equipment that is considered waterproof, clean them up, dry them up, and that is actually considered re-sterilized and safe for reshelving. And because of this, they're able to decrease their waste by 70 to 80% from each of the patients leaving the room. And there are projected savings that reach definitely over $500,000. And our AWISH model is not only just a program in which the volunteers come and they do some work and they leave. We actually deal with our eco-anxiety by building community connections with each other and with the hospital and with the community. So we hold social events at the Stanford farm. We hold educational events within our hospital to teach sustainability and sustainable healthcare practices, as well as, some basic medical training for our volunteers. And in that way, we promote sustainable learning as well as connections with our community and the hospital. And so that's why when we want to look at healthcare in a different light, we want to see that healthcare is not only helping the patient that's in front of you, we want to make sure that healthcare is actually helping the environment as well, because when you treat the environment, you treat public health.
So I think the most important thing for students is to get comfortable with the fact that climate and health problems often do not respect disciplinary boundaries because it makes it difficult because due to the lack of literature out there, and granted it's still growing within environmental health, you're often entering unknown spaces. And as a result, I feel like a lot of people don't realize that niche intersection exists. And so that's why what I would advise for students, especially with interdisciplinary work, is to really start with the question you care about, whether it's related to pollution, the brain, or health inequities. I'm almost certain that climate change has some role in it. And so that's why that question will be able to pull across multiple fields and show that, sustainability is not just siloed into environmental science. It's connected to engineering methods, public health frameworks, and medical applications, and even within business as well. The GSB, the Grad School of Business at Stanford, for example, has actually been holding a lot of sustainability conferences there that, universities from around the world, I think University of Zurich, I believe, I think they came in and did a presentation. This is something that, Stanford cares a lot about. And so that's why, don't be afraid to learn outside of your usual discipline, because that's where innovation happens. If you keep on looking through a certain lens about sustainability, climate change, then you're not going to be able to expand and also find others that may have similar interests as you. And so I think, first thing I would do is also seeking out mentors across different areas, whether that's professors, clinicians, physician scientists, so that way you could see how, each field approaches the problem. And I remember the summer before I was matriculated into Stanford, that's when I got into contact with Dr. Lin, because I immediately knew that I wanted to do something with climate health at Stanford. And so I think we started talking around June before I even stepped on campus yet. And we already had some ideas. And as a result, I think, that bond has made me like hopeful that this is something that will be a key part of my life, even with being a doctor, which is already a demanding job as is. And so that's why it's one of those like relationships we have that are just invaluable. And so I hope that people can find that equivalent so they feel that so that way they can instill confidence in themselves and others about why this issue matters. And so stay patient with yourself. Interdisciplinary paths often look messy on paper, but that's what makes them powerful at the end of the day.
Yeah, yeah. Well said, well said. I was actually going to use Sebastian. You were going to be my model of how somebody, just like a student wants to reach out and number one, learn about things. Sebastian, I've been so impressed by the capability of his mind to just make connections and want to learn all about the different things about how healthcare is affected by climate change. And it's true that by putting yourself out there, asking around, and just connecting with other people, you can actually make more connections with not only healthcare professionals, but with scientists, and just showing up like you showed up to SASE. Just show up to different meetings, different committees, write those emails, meet those people and just say, hey, how can we collaborate? And that really, number one, gets things done because everything is teamwork. And number two, it addresses eco anxiety at the same time because you realize that you're not doing this alone. Nothing can be done alone. Everything has to be done with the groups of people that want to get something accomplished together. So hopefully we keep the ball moving forward. And there's a lot of things that will be in the way. You'll hear a lot of no's in your journey, and just know that you just got to keep pushing through and just be like water, go around the barriers and commiserate with a lot of people when you need to vent.